Good morning or good afternoon, depending on where you are in the country or in the world. I'm Jessica Shore, the Vice President of Clinical Affairs and Quality at the Pulmonary Fibrosis Foundation, and I'm so excited to welcome you all to the first edition of the PFF Disease Webinars Education Webinar Series in 2024. I'd like first to just touch on some housekeeping remarks first. The webinar is recorded and will be available on the PFF's YouTube channel for additional viewing at your convenience. The slide deck for today's presentation can be found on the panel on the right-hand side of the screen in the handout section. In the chat section of the panel, you can send in questions that you may have during the presentation. We'll have a question and answer session after Dr. Dedent is done with her presentation today. You will also be receiving a survey at the completion of today's webinar, and we would really appreciate your feedback on the PFF Disease Education Webinar Series. So thinking about today's webinar, Emergency Preparedness and PF, What You Should Know, it's really great that we have a wonderful speaker joining to us today to talk about what to do and how to prepare for when an emergency happens. Being prepared and knowing what steps you can take now really helps to help you act then when an emergency hits. Today's webinar can be used as a guide to be proactive with your health and emergency preparedness. So we have Dr. Allison Dedent today with us, who is an assistant professor at University of California, San Francisco. She is a pulmonary and critical care specialist with expertise in interstitial lung disease. Her research is focused on reducing health disparities and improving access to care for patients living with an interstitial lung disease in rural and low-income areas. She also studies how telehealth can be used to address geographic barriers to receiving care while living with an interstitial lung disease. A quick reminder that please note the information contained in this presentation is for information and/or educational purposes only. It is not intended to be a substitute for professional medical advice. Always consult your personal physician or healthcare provider with any questions you may have regarding your specific medical condition. At this time, I'd like to turn it over to Dr. Dedent.
Thank you so much, and thank you all for being here. It's really a pleasure to talk with you about something that I think is really important for the pulmonary fibrosis community, which is being prepared in the event of any emergency, and we'll talk about a lot of these today. We can advance the slide, please. Just a quick disclosure that I do receive grant support from the Pulmonary Fibrosis Foundation. And again, re-emphasizing that the information that I'll talk about today is not meant to replace or serve as medical advice, but really to provide education. So please be sure if you have any questions about anything I discussed today to also cover those with your medical provider. Okay, the objectives for the talk today, I want to first review how natural disasters affect health and in particular respiratory health. I'd also like to outline preparations that you can make before a severe weather event or disaster or other emergency occurs. I want to highlight specific actions you can take in certain disasters and emergencies, and I think a few are very relevant to pulmonary fibrosis. And then discuss a general action plan that can be activated in the event of any emergency. This infographic here depicts the rise in the global temperature since the year 1800, and I think this is really important to start this talk because global warming is really contributing to more frequent and more severe weather events. And so being prepared today with the expectation that these events will happen more often, I think is really important. You can see that the temperature not only has been rising since 1800 on Earth, but also over the last 40 years in particular, that rise is becoming more steep. And because it's becoming more steep, we can expect to have more frequent events going forward. Next slide. There are several weather events or disasters that may impact you that are listed here on the left side of the slide. And I think what's important to note is that for most of these, there's some lead time or some advance notice that the storm or weather event is occurring. The exception to that, of course, is earthquakes, if you live in an area where earthquakes are prevalent. So the important thing I think to note about that is being prepared for most of these will give you a little bit of time if the event is occurring as well. But for some of these, they can happen quite quickly or unexpectedly. And so having these preparations in place can be really helpful, particularly in those circumstances. We also see different effects on your health from these extreme weather events. Direct effects to you can be either through breathing or consuming harmful particles or substances that are in the air or in water. Of course, bodily injuries can occur if there are damages to infrastructures or buildings. And then there are various conditions that can occur in settings of extreme temperatures. But there's also indirect effects on your health. And those are a lot of the things that we also want to cover today, including electrical outages, obstructed or damaged roadways, loss of running water, and closure of healthcare facilities in your area that you may need in the event of an emergency. And all of these, as I mentioned, can affect your health in different ways. I want to talk briefly about wildfires because I think this one in particular is very pertinent to respiratory health, given the substances that are in the air and the particles that you can breathe in. Wildfires emit a lot of different substances, but the main takeaway that impacts health mostly is particulate matter. Over on the right side of the slide, I have pictures of a couple of different sizes of diameter of different small particles that we're used to seeing. The first is fine beach sand. That's about 90 micrometers in diameter, and human hair is about 50 to 70 micrometers in diameter. But when we're talking about the fine particulate matter that occurs from wildfire smoke, we're really talking about particles that are 2.5 micrometers or smaller, and this is 30 times smaller than human hair. So these are very small, very fine particles. They can get into the lungs. They can also possibly get into the bloodstream. And importantly, they can also reach the inside of homes and buildings during wildfire events. Older individuals and those who have cardiopulmonary diseases are more susceptible to the effects of wildfires. And it's really in these age groups and people with these conditions where fine particulate matter can be a risk to health. Over on the right side, looking at the graph, these show emergency room visits for those who have either cardiovascular diseases or respiratory diseases. And in blue, these are individuals that are 65 and older. And you can see that these are higher up on each side of the chart, which indicates that the risk for emergency room visits in these individuals with these diseases have been shown to be higher. I think it's important to note for this webinar in particular that these respiratory conditions predominantly included individuals with asthma or COPD. But we know that wildfire smoke can cause respiratory symptoms, can cause bronchitis, can reduce lung function, and lead to exacerbations in these respiratory diseases. We also know that fine particulate matter has similar effects on individuals with pulmonary fibrosis, be it from pollution or otherwise, as we see from wildfires itself. So what we're really doing here is saying a lot of this evidence is not in pulmonary fibrosis for wildfires, but we're extrapolating it to individuals with pulmonary fibrosis because we know that when they're exposed to other sources of fine particulate matter, there's a similar impact on respiratory health. I also think it's important to note that with wildfires, these are really occurring over days to weeks. And so we don't know if there's a long-term reduction in lung function with wildfire exposure because we haven't been able to study these events over a long period of time. But at least in the short term, there is some impact on lung function. So I first want to start by things that you can do to prepare for any emergency and have steps in place to be able to do so. I want to highlight here before I get into the content that this may feel like a lot of preparation, and it may feel like you may not be able to do or look at all of these things. And I would just say what I want to do is give you all of the information, have you make a plan that's best for you, and let you know what resources are out there to you. But I will also emphasize today the things that I feel are really important for you to do in preparing for an emergency. So to start, some public resources that are available. The first is setting up emergency alerts on your phone. There are several different ways that you can do this, and at several different levels geographically, depending on where you live. And what that means is you can sign up for something like the FEMA mobile app, or you can download it rather. And that's something that geographically spans, of course, a greater area. But it can be really helpful because you can set your location and get real-time weather events through this app. You can use it to send notifications to family or friends in the event of an emergency. You can use it to find emergency shelters in your area. And then there's also just a host of FAQs and tips in the app and also on their website that you can access for resources. So I think this is a good one to download if you're able, or to have somebody help you do that, or to download it for you so that you can reach out to them for updates or to access this web page, because there's a lot of useful resources here. If you are on social media, this can also be a really nice way to get updates quickly. If you're not on social media, I don't think it's necessary to create an account for this, but if you do have social media accounts, you may just be able to get quick updates from either the National Weather Service or local emergency agencies. And being in California here recently with the storms that we've been having, this is something that I personally have been accessing and have found it very helpful. And then lastly, in terms of national sites, ready.gov is also very helpful and a very useful resource. There's actually different steps you can take on that site. You can make a plan. You can make a plan based on the needs in your house. So for example, pets are very important to many of us and something that is very stressful in the event of an emergency and having to think about. So having all of those plans in place ahead of time with resources that may be specific to you that I don't cover today are available on ready.gov or may be available. And then they also have forms on there to help you safeguard documents, safeguard your valuables. So a lot of great resources there. And then lastly, 211.org can help you look at emergency resources in your specific community. And then you can also sign up for alerts in your local area as well. So for example, I live in San Francisco. If you text SF alert to a 6-digit number, you can get real-time updates in your county for different things going on or different emergencies. And this is available across other counties in the United States at least. Okay, I think this slide is very important, and this is an absolute must to prepare, because this is very difficult to put together, as you can imagine, for all the things on the slide when you don't have a lot of time. So I would strongly recommend that you start gathering these items and putting together a go kit so that if you do have to leave or you do have to evacuate, you have all of the resources that you need to do so as safely as possible. This includes medications and medical equipment. Of course, you can't keep these in a bag, permanently, because you need to access these on a regular basis. So keeping these at least in proximity, or keeping a list of these items so that you can place them in your go kit quickly, is important. Other things to think about include non-perishable food and a gallon of water per person, tools to open that food and utensils to eat the food, and then appropriate clothing for whatever is happening in your area, whether it be winter, whether it be extreme heat, whether it be flooding. Make sure you have different types of appropriate clothing so that you can protect yourself from the elements. Flashlight with extra batteries is important to have. Oxygen supplies, I separated from medical equipment because I really want to emphasize how important it is that you have these supplies with you if that's pertinent for you. Phone and other essential electronic devices, and this includes power banks and power portable chargers as well. These are really useful to have. Obviously, if there are electrical outages, you can bring your phone charger, but if you can't use them, they're not really as useful to you in those moments. And then N95 masks are really important for those with pulmonary fibrosis. So we'll talk about a couple of instances with wildfires where this could be really useful. But if you also have to evacuate, and depending on your circumstances and depending on how many people you're around, you don't want to feel vulnerable, or more vulnerable than you already do, by feeling like you're unable to protect your lungs in certain conditions. So have some N95 masks with you so that you can have them on to protect your lungs and protect yourself. Cash is important to have, not something that we may think about, but of course you cannot use credit cards in many circumstances if there are power outages. And then copies of important documents in waterproof containers. This is important, of course, if you're in a flood or a fire in particular, but just gives you that peace of mind. And again, there's some resources on ready.gov for how you can safeguard these as well. And then a first aid kit and sanitation supplies are very important to have as well for your health. And then if you do need to evacuate, or even if you're not sure whether you might need to evacuate, it's always good to have a plan in case this occurs. And you want to talk this through with your providers in your healthcare setting and your family and friends to make sure that this really makes the most sense for you. The first question you should ask yourself is, can I evacuate if I need to? And you can contact your county's emergency management agency to ask about specified evacuation routes, or if you're concerned that you might not be able to evacuate, to ask for some recommendations on how you can act in those settings. If you do need to evacuate, there's a likelihood that you will need extra time. It's always important to remember that storms can escalate very quickly, and traffic to evacuate will worsen as the event approaches. So to keep in mind that being prepared or leaving early if you need to is important. And then also look to see if there are alternate routes for evacuation in case your usual roadways are impacted. I always think about a few years ago when I had a friend who was impacted by the wildfires here in California, had to evacuate very quickly with animals and small children, and was by herself. And so having, and she could only go in one direction, and a lot of the hotels in that direction were already full from other individuals calling and booking rooms. So keep in mind that having a sense of what is in your area in a 360 viewpoint can be really helpful for certain emergencies when perhaps the way that you would typically go or the route that you would typically take is impacted and you need to find an alternative direction. Next slide, please. And then you also want to know whether there are emergency shelters or disaster recovery centers in your areas, as well as hotels in different directions, as I mentioned. You can locate these on the FEMA app that I talked about a few slides back, or you can text DRC for disaster recovery centers and your zip code to 43362. in the event that you're finding yourself in an emergency and you don't have a place to go or evacuate and you need to access a shelter or a center. This is, of course, something that we try to do, but just a reminder to keep your vehicle full of gas. If the power is out, as many of you may have experienced in hurricanes, for example, you may not be able to get gas, and this can leave you feeling vulnerable and stressed. So if you do have some lead time for these weather events or disasters, please be sure, if you have a vehicle, to go make sure it's full of gas, because you may not be able to get gas during the event or even for a little while after the event. Make sure you have a map in the glove box. You may not have service or data. We may have all been in areas before where we get lost and then we don't have service on our phone to use the maps function. So like we used to do back in the day, have a paper map of your area in your glove box so that you can access it if you need to. And then also keep a separate cord to charge your phone in the car, because this can be an issue as well. If you're waiting in traffic for hours, you don't want your phone to die as you're using the maps function or you're trying to look at some of these resources. And then I think the last important point is, don't assume that hospitals will be able to take care of you or bring you in if you're not having a medical emergency. That's why it's important to have evacuation plans in place, whether talking to friends or families, hotels, shelters, seeing what your options are. However, I'll talk about this again in a few slides, but if you do run out of oxygen, if you're not feeling worse, but you run out of oxygen, that is a medical emergency that you should seek care for. And then I know this document is hard to view. It's not really meant for you to be able to see it too detailed here, but I just wanted to put it here to let you know that the Pulmonary Fibrosis Foundation put together an educational brochure with all of the content that I'm presenting you today, and it is available on their website under the education materials. And this form is really nice because it allows you in one place to write down the names of your healthcare providers, important contacts, who your oxygen provider is, what your pharmacy number is. That way you have it all in one place so that if you need to make phone calls or you need to provide this information to somebody fairly quickly, you have it all in one place. You can print this and fill it out. You can then take a picture of it so it's also stored on your phone, so you don't have to worry about losing a paper document. But this is a great resource that I wanted to make sure you were aware of so that you can keep all of your important information in one place. Okay, let's talk about preparing for some specific emergencies that I think are helpful to keep in mind. The first is power outages, and I think that this is something that can significantly impact the pulmonary fibrosis community, which is why I think it's really important to have dedicated information on this in particular. These can occur in extreme weather events, and in these circumstances, as I mentioned, they can last for weeks, but they can also occur for 24 or 48 hours. So even outside of an extreme weather event, I think this information is very pertinent. Keep in mind what will be impacted. This could be stationary oxygen concentrators, battery-powered portable oxygen concentrators that require you to charge the batteries after a certain amount of time. Any electrical medical equipment, powered wheelchairs and scooters will be affected. So if any of this is relevant to you, please use these resources now, or hopefully in the future this can be useful to you if becomes applicable. This is really important. Something that I strongly recommend for you all to do is, if you are on oxygen or you do have electrical medical equipment, to notify your electric company now. They can place you on a priority list so that if the power does go out, you are prioritized for your power to come back on as soon as it is possible. You might need to have documentation from your medical provider to get placed on this list. I can say that most of us would be very happy to do that for you. And having that in place early can be helpful because, as we all know, the power can go out anytime, whether there's an emergency or event or not. And then lastly, this might not be feasible for everyone, but something to consider or look into. A generator can be helpful in these circumstances as a backup power source. Please be sure that it's professionally installed. If you do have a generator, according to local codes, these can be dangerous if they're not installed properly, but this can be another option for power if you find yourself in these circumstances. One piece that I think is really important to do all of the time, but particularly in emergencies, is to be sure that both you and your family or loved ones or someone that you live with understands how to operate your oxygen equipment. I think that this is a useful tip whether there's an emergency or not, because if something does happen, you have somebody who can help provide support and helping you with your oxygen equipment if there's an issue. The other piece that's really important to do is to make sure you have an understanding of how long you have with whatever oxygen device you're using, whether it's a cylinder, whether it's a battery-powered portable oxygen concentrator. How long does that oxygen last based on the liter flow or the setting that you have it on? All of these things can be provided to you from your oxygen company. So if you aren't sure what the answers are to this question, you can reach out to your oxygen company and they can provide you with these resources and help show you how to use the equipment. Something else that's really important to do is to advocate to have extra oxygen cylinders on hand in case there's an emergency or a power outage. So again, the cylinders don't rely on power for support. So please advocate for yourselves to have some on hand. And again, knowing how long your oxygen lasts based on your liter flow is important for this step as well, because you want to make sure that you advocate for the extra amount that you need. That may be more or less depending on how much oxygen you're on, but if you don't know that information ahead of time, you may not be able to advocate for the amount that you need, and your medical providers would be very happy to help you do this if you're running into trouble. If you do have a power outage, so I've asked that you call your electric company now in the event that an emergency occurs. But if an emergency does occur, I also recommend that you call them immediately to let them know that you're an oxygen user. They may say, yes, we have you on a priority list, but that's a good time to double check that they're aware that you're an oxygen user and it's really critical that you have power. Again, if there's an emergency, call your oxygen provider who may be able to provide oxygen tanks or cylinders that don't require electricity. It's also important to limit your physical activity, particularly for individuals who use more oxygen with exertion than they do at rest. Again, the higher your setting, the less time you have with a given cylinder of oxygen, for example. So anything you can do to conserve that amount by limiting your activity as much as you can within reason can be helpful. And then again, to emphasize that if you do run out of oxygen, that is a medical emergency and you should please seek care immediately. Okay, I want to talk about wildfires a little more, as I mentioned at the start of the webinar, because I think of all of the disasters, this is the one that clearly emits particles into the air that we can breathe in and are really relevant for individuals with pulmonary fibrosis or their loved ones. So if you find yourself in a wildfire, in an area of a wildfire, or even if you're not in an area of a wildfire, as we saw for many individuals in the Midwest in the United States or I think it was just last year, from the smoke coming down from Canada. Okay, the winds can carry these particles quite far. And so I think this information is useful for everyone, whether you live in a wildfire area or not. The first thing that you can do in a wildfire event is to look at air now. Air now will tell you what the air quality index is. The higher that air quality index, or AQI, the more unsafe the conditions are, or the more particles are in the air. Anything greater than 100 is unsafe for individuals who have pulmonary fibrosis. But it's also important to note that you may have symptoms at lower levels, and that would not necessarily be unexpected. Some of those symptoms might be from the wildfires, like headaches, or you also may have some of those respiratory symptoms that I mentioned. So it's very important in these circumstances at any level to monitor how you're feeling, monitor your oxygen levels if you're able, and monitor your symptoms. Again, very important for wildfires. This became a little more commonplace across the world as a result of the COVID-19 pandemic, but is also very relevant to wildfires. Wear a well-fitting N95 or KN95 mask if you are outside in smoky conditions to protect your lungs. The well-fitting piece is important, as it was for the COVID-19 pandemic as well. So if you're finding that something is too loose on your face, try to find an alternative that fits well and gets a little bit more of a snug fit on your face to keep you protected. Limit your exercise outdoors for similar reasons of these fine particles being emitted in the air during wildfires. When we're exercising, it's a natural response for our body to deepen our breaths and increase how fast we're breathing, and that can really have a differential impact, just being outside in the environment, but also the normal response that our bodies have to exertion. So try to limit your exercise or exertion outdoors in these circumstances. And then if you are inside, remember that these fine particles can enter homes and buildings. So you want to keep your windows closed, but you can also set your air conditioner, if you have one, to recirculate the air. You can also use air purifiers that have HEPA filters in your home, but you really want to be sure that your air cleaner does not intentionally produce ozone. And the California Air Resources Board website has a lot of resources for this in particular, and this is in the brochure that I mentioned that's on the PFF website for this topic, if you want to go there and learn more. And then it's also important to minimize indoor pollutants. So I think it goes without saying for anyone who has pulmonary fibrosis, no smoking in general, but very important to not be around smoke from tobacco products during these circumstances as well. Try not to burn candles or incense. Reduce the use of any gas or wood burning stoves during this time, and reduce your frying of foods. If you do have to do stovetop cooking, turn on the range hood vent in those situations. And then try to avoid vacuuming in your home unless your vacuum has a HEPA filter, because you will potentially throw around any fine particulate matter that may be in the home. And then the same thing with dusty surfaces. You want to wipe those with a wet cloth before you then wipe them with a dry cloth. Again, not to aerosolize fine particles that have maybe settled onto surfaces into the air. And then I think flooding is something that requires a little bit of preparation as well, and attention for pulmonary fibrosis. If any of you are being impacted by this in California right now, this may be useful to you as well. If your basement or house is at risk of flooding, create a plan to move any important items and equipment to higher ground, and really prioritize, if you can't take everything, what the critical things that you may need to move to higher ground are. Make sure your sump pump is working, and dehumidifiers can be very helpful in these circumstances as well. And then I think this last piece, if you have any water damage or mold in your home, this can be really relevant to pulmonary fibrosis, particularly for individuals who have chronic hypersensitivity pneumonitis, for which water damage or mold may be or may have been a trigger in the past. Consider having these areas professionally cleaned. And then I think this last piece is really to just be an action plan that summarizes the important information that I provided to you here today for any type of emergency. Number one is, if you find yourself in an emergency, check public announcements that I mentioned on some of those resources earlier in the slides. So be in the know, see what's going on so that you can make sure that you give yourself enough time to decide if you need to evacuate or not. And then this is also a good time to check your Go Kit and other resources that you've put together to make sure it's complete, to make sure food hasn't expired, and to go ahead and put in your equipment and your medications or things that is just not feasible for you to keep in a bag on a regular basis. The second thing is to check all of your essential devices. Check all of your battery powered devices. Make sure in that Go Kit that your flashlights work, you have extra batteries. Check everything for power because, as we all know, the more that we're checking our phones for updates or looking at resources, the more we might be depleting that power. So check the charge, keep it on the charge is step number 2. Step number 3 is to contact your healthcare providers if you need an emergency supply of medications. So this works very differently depending on where you are. This works very differently depending on what your insurance is. And so there's not a great one-size-fits-all recommendation for this step. But it is to say that you can call your providers, tell them you're experiencing this emergency and you need to get a 2-week supply of your medications. Sometimes they can write that in the prescription as a separate prescription to your pharmacy in the event that the pharmacist says you can't fill your prescription early. Step number 4, call your oxygen supply company. I've said it many times. I'm saying it again because it's so important to do, and the electric company, to make sure that they understand that you are on oxygen. Step 5 is review potential routes again for evacuation. Ideally, you have put these into place ahead of time. Take a look at these, review these, including locations of hospitals. This is helpful to have a snapshot ahead of time, again, in case a typical route that you take is impacted and you need to go a different direction. And then make sure that you review your plans in the event of an emergency with a trusted family member or friend. I will say, in that circumstance I had with my friend a few years ago, they were not able to drive out of their home and seek shelter in a hotel and be looking up hotels to stay in. So I was looking up hotels for them from afar, booked it, and then sent them the address so that they could get there safely and not have to worry about that. So leverage your networks for help in these circumstances. And then lastly, monitor your health very closely in the event of an emergency. Seek care immediately if your condition is worsening, and knowing where those healthcare centers are on your routes can give you peace of mind and provide less stress that you have to worry about the logistics and focus on your health. This is a list of resources that covers all and more of what I've covered today. Again, I just want to reemphasize that there is an emergency preparedness brochure on the PFF website under the educational materials with all of this information. It also has hyperlinks embedded into it where you can access some of these other resources. A couple of the pulmonary foundations provide resources on these topics as well. And please go to some of these, look at them now, check them out, and see if they have some useful materials for you to prepare. And that concludes my presentation. I want to thank you all so much, and I will take any questions that you have at this time. I have a few questions that I'm seeing now, so I'll go ahead and address those if that's okay, just to get started. The first question is, at what point should you treat normal weather, example, thunderstorms in the spring, as an emergency situation, and how prepared should you be? That's a really good question. There's, I think, different ways to view this, but from my perspective, the mantra that you can never be over prepared, but you can certainly be under prepared, I think really applies. So what I would suggest is to take a look at some of these resources now. Just start browsing them, perusing them, set yourself up for emergency alerts now. If you're on oxygen, let your oxygen provider know now. Get these plans into place, because even in a thunderstorm, as you know, the power can go out. And so it really just is setting yourself up in case something happens, if you're not necessarily in an area of the country affected by extreme weather, or the world, although I think those places are becoming fewer and far between. So you really can't be over prepared, in my opinion. Question number 2, is it considered safe to drive with multiple oxygen containers in the car? So I think there are different scenarios where that can be challenging to do, depending on the type of event, or can be concerning. But what I will say is, you need the amount of oxygen that you need based on your liter flow, based on where you're going. So if that can be a good situation to recognize what's on your route and where emergency shelters are. Perhaps you may need to make stops along the way, and have checkpoints, so to speak. But you need the oxygen that you need, because the alternative is, if you don't carry what you need, then you might run out of oxygen, which is a medical emergency. So I know that can be a tricky scenario, but my recommendation would be to make sure you have as much oxygen as you need to get you where you're going, your final destination, for your safety. And then number 3, what should one do if an oxygen provider will not provide extra tanks for emergencies? Well, I think there's 2 things that you can leverage in these circumstances. Call your healthcare provider, number 1, and ask them to help advocate on your behalf. The second is, if you do run out of oxygen, or are you at risk for running out of oxygen, then seek medical care. And that may be able to help tide you over. It may just be that if there are a lot of people impacted in your area, it may not necessarily be that the oxygen is not coming. It may just be, there may just be a delay. So I think that's a less optimal option to seek care, but certainly one that we would encourage, because we don't want you to be without your oxygen. But really leverage your healthcare providers in these circumstances to support you. And then question 4, are there special resources or suggestions for those in California with planned power outages? That's a great question. So I think the planned power outages in particular is one scenario where it's very important to place yourself on that priority list. Because they will leverage that for these planned power outages, or rolling blackouts in other areas. So that's a big suggestion there that applies for planned power outages. Let your medical providers know as well if you're in an area that is planning a power outage, so that they can make sure that they can get involved if they need to get involved. That's something that I always ask my patients to do, is to keep me informed, because I don't want them to be without oxygen, and I also want them to know that that we can help and support them. And then the 5th question, any emergency battery recommendations to use? I don't have any in particular. These resources may have some that they suggest. I think the the key that I look for is one that lasts a decent amount of time, one that's not going to provide me 2 hours of charge or 3 hours of charge, but it's going to provide me more than 12 hours of charge. So those are helpful to look at. Some individuals may have certain resources, so certainly please feel free to share those with one another if you have one that you like. And then best phone numbers to keep on hand. So that document that I had showed you, that one-page document, has categories that you can think about. But I would say now we're really in an era where memorizing phone numbers is really not common. So I still have some phone numbers memorized from when I was younger because they're the same of my family and friends. If you don't have those memorized, put those on your document. As I said, my friend was able to leverage me in helping her in these circumstances, and the last thing you want is to not be able to even call a friend for help if your phone dies. So close friends and family members that you trust in these circumstances to help you are good to put on that list. Your pharmacy phone number and address is good to put on that list. Your healthcare provider phone numbers are good to put on that list. Any hospital addresses that you may need to access are good to put on that list. And then if you're on oxygen or you have medical supplies, those phone numbers are great to put on that list. And there are a few others there as well that you can use, but really those I think are the core numbers, and then your electric company as well if that's pertinent to you. And then the next question is, can pharmacies give you extra or emergency doses of prescribed medications? Yes. So this is something that you may run into on a regular basis when you go to pick up your medication and the pharmacy tells you it's too soon to fill your prescription and you need to come back in X number of days. This could happen in an emergency, and if it does, this is where it's important to reach out to your healthcare provider. Sometimes, for example, the provider can write that it's for an emergency in the prescription and give you a 2-week supply. Sometimes that's not even necessary. It just really depends on where you are, what your insurance is, and what the requirements are. But the bottom line is, if you find yourself in an emergency, you only have a few pills left, call your healthcare providers right away and let them know what's going on.
Allison, these are all really good questions, and I'd like to also thank you so much for your presentation. It was very comprehensive. I had a question for you. There was a lot of information, and sometimes it's just getting started is the hardest part. Yeah. And so if you could make one recommendation to start today for folks to be prepared for an emergency, what would that be?
Well, it's hard to make one, but I would say maybe I'll say 2. One is
2 or 3. Sure, that'd be great.
I think is I really like ready.gov personally because it takes you through a step-by-step process. As you're mentioning, this is a lot. It's hard to know where to start, and this really takes you step by step through how to think about preparing, and in a way that's specific to you. Again, I didn't really talk about evacuating with pets, but that is likely very important to many of you who are here today. So there's some resources there. So I would start looking at that website as a step-by-step guide. And then I would also just say if you do have electric medical devices, to call your electric company, your oxygen company if that's pertinent. I think those 2 things are a really great starting point. And then you can start to prepare some of these other things in the background, your to-go bag, making sure that you have important documents or valuables together. You can take a more of a piecemeal approach there.
Great ideas. It's just getting started, and I know that you've been a real inspiration now. It is to get folks to start.
Yeah, it's sometimes when these things happen, you might have some lead time, but they might only be 3 or 4 days. And as you can see, this is a lot of information to try to pull together that quickly. So a lot of these things, and going back to that first question, how prepared should you be for a thunderstorm? Really the goal in my eyes is to be prepared for really a catastrophic event. And then you may not need all of those things for a less severe event, but you'll likely need many of them, and then you have them available.
Great.
This is a great question. Different recommendations for patients who live in rural versus urban areas. I think all of these recommendations apply, but some of them start to move up the list as a little bit more pertinent. So for rural areas in particular, the challenge is how remote are you and how many evacuation routes are there. So in those circumstances, you may be somebody who leaves earlier or may need to leave or may need more time to leave based on your situation. It also means that there may be fewer resources in an emergency, like oxygen providers or healthcare centers. So I think when you live somewhere in particular that's more remote or further away, even an hour away, to be prepared and sort of know where you're going to go and what's available to you if you needed to get care. And then, I think the things that are really pertinent in urban areas is the sort of infrastructure and crowding that can happen in some of these situations. So, if an event goes through an area that doesn't have a lot of buildings or infrastructure, there will be damage, certainly, but it's very different if something came through, say, San Francisco, which is densely populated with buildings. And so there may just be more obstructions, there may be more crowding, and I think those things are more pertinent. And then, of course, there's more people that might be impacted in a city. So keeping in mind that when you're calling for resources or you're calling companies, that call density may be higher, and so doing things as early as possible can be important in those situations too.
Thanks, Allison. I just had a thought as well as that, today we've been really talking about pulmonary fibrosis or lung disease, but it's important too to remember, any medications and everything that really you do every day to take care of yourself. And just a reminder, I think, to make sure you have all of your healthcare providers' information on a piece of paper. And sometimes even if it's something you don't use on a daily use, but maybe you need it as needed, to make sure you keep those things stocked. And so, any thoughts on that?
I completely agree. I think that I highlighted a few emergencies that I think are really impact individuals, in particular with pulmonary fibrosis, for different reasons. But these affect everybody with any level of health impairment. And so anybody that is a member of your healthcare team should be involved in these circumstances. If you have a need, particularly for medications, or you don't have power, because we're a very specialized community. We all want to help you, but we all have different strengths and can help you in different ways. So please involve all of your healthcare providers.
Great.
And then if a medical need does arise during an emergency, should you call your provider first or go to the emergency room? I think it depends. And I think this is something that can be really challenging even when there's not an emergency. But I always tell people to listen to their bodies, and if they feel like they need care, now they should seek care. Sometimes, when you reach out to your provider, there could be a delay in a response, not always, but sometimes. And so if you don't feel like you can wait for a delay in responding, then I think that's a good time to go. If you have a medical need in particular during an emergency, I think the thing to keep in mind is these weather events can really escalate quickly. So if you are really feeling like you need to seek care, I would recommend that you do it, because if you wait and it either becomes harder to evacuate you or get you to a healthcare center, then that can be really impactful on your health. So if you're having something that you don't feel like is an emergency, but it's a need, then I would suggest that you reach out to your medical provider. If you have a medical need that's urgent or even emergent in a disaster or a severe weather event, I would suggest that you consider going, given how quickly wildfires can spread and how quickly rain patterns can worsen or flooding can worsen.
Yeah, that's great information, Allison. I also think that, with anyone that has any chronic illness or, has mobility concerns or anything, how important it is to just be proactive
Yeah.
and get as prepared as possible. I mean, these things can, like you said, there could be lead time, but sometimes there isn't, and how important it is just to know where things are and be prepared. It also, I think, can help in the midst of a situation that is unexpected. It just helps you feel a little bit more like in control, like, okay, here's step 1, 2, 3, right? Because you've written things down and you can kind of go through. So I think you have provided such great resources, and we so appreciate your presentation today. And I would just like to let everyone know in the audience that if you still have questions or questions come up after today, that you can go ahead and reach out to the PFF Help Center and we can help get those questions answered for you. And so, Allison, I just wanted to say thank you again. We really appreciate all the work that you've done in this presentation, and thank you to our audience for being here and listening and getting a little bit more prepared.
Yeah, absolutely. Thank you for having me. It's a pleasure to share this information with all of you. And please leverage the resources on the PFF website for if you missed anything or just want to go through it again. It's a great resource.